Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps like Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Episodes also air Sundays at 10 a.m., 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, and 105.1 FM and 1050 a.m. in Lynchburg. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. Today we're joined by Dr. Vipul Patel, the Medical Director of the VCU Health Hume Lee Transplant Center and a faculty member in the Division of Pulmonary Disease and Critical Care Management in the Department of Internal Medicine. Dr. Patel is here to share insights about the work of the Transplant Center, as well as a major milestone, the center's first successful lung transplant procedure. So, welcome to the show, Dr. Patel. Thanks for being with us.
Thank you. Thank you for having me.
Yeah, we appreciate you taking some time today. Return listeners know that we like to start these conversations just by getting to know our guests a little bit better. What we do know about you is that you attended the University of Baroda Medical College, completed your residency and internship at SUNY Downstate Medical Center, and then continued your training with a fellowship at the Norton Thoracic Institute at St. Joseph's Hospital and Medical Center at the University of Southern California. Beyond those few details, though, just tell us a little bit more about your unique personal story, including what attracted you to medicine.
Well, it's a long journey, and if I look back, the journey started when I was in school and back home in India, where the population is large. To help out each other is the way to achieve a good goal and career. And what attracted me in the medicine is you can help out people in trouble, and that lead me to into the medicine. And over a period of years, slowly I developed this interest in giving more to the patient. Initially, I was an internal medicine physician, then lead to pulmonary critical care, where the patients are much more sicker, especially in critical care arena, and also, along with that in pulmonary disease, where lots of diseases in the pulmonary field, the patients don't have much option, and eventually lead me to a career in lung transplantation. After I entered into the lung transplant field, I noticed that it is a lot more to give to these patients who does not have more options for their medical disease from the medicine or surgical aspect.
That's great. We appreciate you sharing that background, and I really like your perspective on that. That's really cool. As a baseline, before we dive in, let's just start by talking about organ donation and the work of the VCU Health Hume Lee Transplant Center. Right now, for context, there are more than 103,000 Americans on the national transplant list, and each day, 13 people die waiting for an organ transplant. Last year, more than 48,000 organ transplant procedures occurred in the U.S., which includes nearly 600 at the award-winning VCU Health Hume Lee Transplant Center involving heart, kidney, liver, and pancreas transplant. The history of the VCU Health Hume Lee Transplant Center dates back to the 50s, 1957 actually, when the Medical College of Virginia completed the first organ transplant in Virginia and then created the nation's first clinical transplant program. So, with that context, tell us a little bit more about the organ transplant process from the patient and provider perspective.
Well, as you know, there is always shortage of the organ for the transplant, and the distribution of the organ is a important role the transplant physicians are involved into. Now, if you look at the lung donor, meaning especially in the donors whose lungs are coming, and the lung is one of the most delicate organs that is damaged into the donor body. And as we know, that there is a shortage of the donor in the United States. So if you look at the particular organ lung, it's even more shortage there. So it's true that patients die while waiting for the life-saving organ transplant. Many patients die because of that. But it's also important to know that the transplant is increasing as the years pass by in last 50 years. And that is what we are, we can take positive out of this organ transplant history, that we have achieved a good outcome in last 50 years. As you know, in 1950s, 1960s, first organ transplant happened. However, the transplant outcome was not so great, but now with the new advent of new medications and immunosuppression, we are able to achieve a better outcome for the patients going through the organ transplantation. Especially in lung transplantation, last 3 decades, we have a significant growth of almost about 15% rise every year in the lung transplant. At VCU, we have started the Human Transplant Center in early 50s, early 60s. However, the lung transplant program hasn't developed in last 3 decades, despite the lots of efforts are made. Finally, we are able to start lung transplant program with good success.
That's fantastic. So, for context, and return listeners might know this, a recent guest on this podcast was a North Carolina woman who's a double transplant patient. She had a heart transplant in the mid-90s, and then I believe a kidney transplant a few years later due to renal failure. In the 30 years since those procedures, there have obviously been, like you touched on, advances in surgical techniques, immunosuppression, organ preservation, all that stuff. And that's led to increased transplant procedures, but also increased success rates. I wonder if you could sort of take us through, and I know you weren't a provider in the 50s when this process started in Virginia, but I wonder if you could tell us a little bit about the specifics of the process. So, like, someone's on the wait list, they learn that there's an organ available for transplant. What's the process like taking care of that organ, literally moving it and getting it ready to be transplanted? And maybe, you know, if you have any insight into that, tell us about how that's changed over time.
Yeah, I mean, I can talk about the lung transplant a little bit more than other organ transplants. But if you look at the history, the development of the organ distribution, initially it was local, but since in 1984, the HHS come up with the OPTN, Organ Procurement and Transplant Network, and later on, United Nations Organ Sharing, the organization, they received the contract to establish and follow the laws related to organ transplantation. So in lungs, there is a lot of change happened over a period of time to be fair to every patient who are waiting for the lung transplant, especially in last 3 decades. In prior to 2005, it was first come first serve, and when patients are listed according to their when they hit the waiting list, and whosoever comes first on the list, they receive the organ transplant first. Later on, we noticed that the many patients who has progressive disease, they die while waiting for the lung, while the patients who are having a slow progressive disease, they achieve the transplantation benefit. So in 2005, the lung allocation score system developed, where the organ distribution was based on the medical urgency. The people who are more sicker and they receive a higher score, so they can get the transplant earlier than people who can wait for the transplant. They have lower score and they can wait for the next organ offer. Over a period of time, we noticed that there is also a little problem with those kind of a system where patients has to get sicker to achieve a transplant, and it's unfair to the people who are sitting at home waiting for the transplant. They have to wait even longer. So now the system has changed in last 2 years. From the March 9th, 2023, composite allocation score system has been established for the lung distribution. In this system, not only the patients who are having medical urgency, they are having higher score, but also the patients who can have better outcome also get a better score to get the transplant earlier. So it's fair to everyone, and this modeling developed in last 2 to 3 years, and we will come to know whether this is a very good system. As we grow, we are learning each day, and try to be fair for every patient.
That makes a lot of sense, and it sounds like, folks who are in charge of making these decisions about determining kind of like a candidate profile, who's the best kind of candidate for this transplantation procedure, is, responding to feedback, making sure that they're continually, improving the process and everything like that, which is great to hear. That leads us right into sort of our main topic for today, and we touched on it a little bit earlier, which is this major milestone that VCU Health has just hit, the first lung transplant. I want to provide a little bit of context, and you touched on how there have been more transplants in recent decades and how those success rates have improved. So 25 years ago or so, there were only a few hundred procedures performed each year in the U.S., lung transplants specifically. Today, the annual number is closer to 3,000 transplants, but as you mentioned, they're performed in situations involving end-stage, severe, life-threatening lung diseases such as COPD and cystic fibrosis. And as we mentioned earlier this year, your team performed the first successful lung transplant at VCU. What I understand, and as we've talked about, it's a complex, intricate, multi-hour surgery. Can you tell us about the procedure, what it entails, and then maybe more broadly what this milestone means for you and your team?
So it is very, very exciting to have this milestone. The surgery is very complex, especially the lung transplant compared to other solid organ transplants. It's one of the most complex surgery. It entails removing the diseased lung and replace with the normal organ from the donor body, and replace at the site of where the previous lungs were. It's called orthotopic transplantation. So now, such organ transplant for the lung, similar to the heart transplant, where the new heart goes into the place where the old heart was. Not so in the kidney. Kidney can go in other places where it's easy to operate and easy to place the organ. A transplant surgery involves detachment and reattachment of the normal donor at three major areas. One is bronchus, second is a pulmonary artery and pulmonary vein cuff, that is left atrial cuff. So the surgery itself involves the connections with the heart chamber, lung with the connection with the heart chamber. So many times the surgery is performed on cardiopulmonary bypass support. The patients are supported, their physiology, their circulation is supported by the heavy machinery during the surgery. Patients usually come out of the operating room having a breathing tube and many chest tubes as well as many catheters to monitor, and their condition remain critical for first 2 to 3 days. That is because of the surgical challenges to perform the lung transplantation. As the patient come out from the operating room and stay in the ICU, our aim is to get the breathing tube out first, so the patients can start breathing normally and they are able to participate in the therapy in next few days, few weeks. Patients stay in the ICU for a few days, followed by on the medical floor for a few days. What we noticed in most of the transplant process, patients usually enter into the hospital with the requirement of the oxygen supplementation. At home, they have very poor quality of life prior to the transplant. But our aim is to get them stronger and better as the recovery happens, and we also ask the patients to ambulate. Most of the patients go home without oxygen, and they're able to perform the activity of daily living without difficulties, and their breathing is come back to spontaneous, which is not present before. So with the lung transplantation, despite the complex surgery, patients can have better outcome and quick recovery. Most of the patients can recover within 1 to 2 weeks. So yes, we have achieved this milestone about 1 month ago. Our first lung transplant after 19 years that we have performed, and the patient we are able to discharge patient in 16 days after transplant surgery, and he started living normal life.
That's great to hear. You touched on the patient who benefited from this transplant. I think I saw that he's, a 40-something-year-old person from Williamsburg who, due to premature birth, had been living with a lung condition for years. In a news article I saw about the procedure, one of the things that kind of jumped out at me was, I think he said something to the effect of, last year I couldn't blow out my birthday candles, but this year I can. Which is it's just a really cool way to describe what an extreme improvement in quality of life he's having. Yeah. So clearly it's demonstrated that this procedure can have those major impacts. I have to imagine that outcome is personally gratifying for you and perhaps instructive as well. I wonder, from a clinical perspective, what are some of the takeaways you've gotten from this initial procedure? Well,
there are lots of things that we can get from this first procedure. I mean, it is a teamwork. First of all, it's not only a medical team with a couple of colleagues with me, but along with the surgical team led by Dr. Hashmi, Zubair Hashmi. He is the one who leads the surgical team. And along with that, there are many people who support this team, including social worker, nurse coordinator, financial coordinator, and many other people. So it is, first of all, it's a teamwork. And the things that we can learn from this first successful transplant is this is just a beginning, and we would like to achieve the similar outcome for almost all the patients. And as we grow, as we move forward with this process, we learn and we refine our efforts to make this journey for the patient much more smoother and much more pleasant rather than painful.
I love it. And I know that you just touched on this. I think you described this first lung transplant as the beginning of a new chapter, which is also very poetic. So nicely put. Looking ahead, what's your vision for the future of this program?
Well, I was looking forward to have a successful transplant program that the world can see us as a center where you can get the help, where the other centers, patients cannot achieve lung transplant at the other centers. So my goal is to have 30 to 50 transplants in next 3 to 4 years, with the growth of 15 to 20% each year, and more importantly than volume is outcome. I would like to achieve a very good outcome that exceeds national average, so we can transplant more and more patients when they need.
Well, you started out by your drive to help people, and you ended with talking about your drive to help people. So I think that's a great bookend for this conversation, and we really want to thank you for taking some time today. Before we let you go, we do have a little game that we always play at the end of these podcasts. We have a tradition where we ask 2 questions to our guests, a pair of fun questions. And to keep things interesting, we have a list of 10 mystery questions. So if you would, pick 2 numbers between 1 and 10, and then I'll ask you the corresponding questions.
Okay. So one number from 1 to 10 is 7.
7? Okay. If you could choose one superpower to have, or any one skill to instantly master, what would it be and why?
Oh, right. I mean, as a physician, I would like to have the one superpower is to operate. I mean, surgical aspect. So I would like to develop a skill to operate on the patient rather than just manage the patient. And that's the superpower I would like to have.
Love it. And then one more number between 1 and 10 to close this out.
5.
5. Okay. This is an interesting one. If you could spend the day with one person from history, living or otherwise, it can be modern history, ancient history, anybody, who would it be and why?
This is a simple question. Mahatma Gandhi, Mohandas Karamchand Gandhi. He is my hero in the history. As you know, he is very simple. You can see he is he does not have much muscular body, but he's so powerful. The way he lived his life, his legacy, it touched me, and I would like to be even if 5% of like him. That's an achievement for me. That's how he lived, that's how he lived his life. And if I can spend one day with him, I would love to have that.
Yeah, absolutely. I hear you there. Well, those are both great answers. And with that, we have come to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. Once again, thank you so much to our guest, Dr. Patel, for joining us today. It's been great to speak with you, so thank you.
All right, thank you.